Assalamu alaikum. Greetings to all the students of pharmacy. So today we will study about antidepressants. As we all know that depression it is a mental illness which is characterized by pathological changes in mood, loss of interest or pleasure, feeling of guilt or low self-worth, disturbed sleep or appetite, low energy and poor concentration. It can be severe and sometimes may lead to death. Symptoms: depressed mood most of the day, markedly diminished interest or pleasure, significant weight loss or gain may happen, insomnia, loss of sleep or hypersomnia, increased sleeping, agitation, disturbance, fatigue, or loss of energy. These are the symptoms which a depressed patient may feel. Symptoms: other symptoms include change in appetite, lack of concentration in your work or studies, poor self-esteem or self-worth, thought of doing suicide which may lead to death. The main mechanism behind depression is associated with changes in the level of neurotransmitters in the brain of the patient that help the nerve cells to communicate with one another. The main type of neurotransmitters which are released and which block the depressed state are serotonin, dopamine, and norepinephrine. The level can be influenced by physical illness, genetics, substance abuse, diet, hormonal changes, brain injuries, or social circumstances. So, the mechanism of depression illustrates that when there is deficiency of serotonin, dopamine, and norepinephrine may be there, so the patient may be feeling depressed state. Now we will be moving towards the main categorization of antidepressant drugs. What are antidepressants? They are mainly those drugs which enhance alertness and may result in an increased output of behavior. They may increase directly or indirectly the action of neurotransmitters such as dopamine, serotonin, noradrenaline. The purpose of antidepressants is to increase the neurotransmitter in the synapse. What is synapse? Synapse is basically the gap between the two neurons. So when antidepressant drugs are given, they increase the level of dopamine, serotonin, and noradrenaline in the synapse. So the neurons may be having such chemicals, so the mood swings or the depressed state may be reduced. Antidepressants are mainly useful to relieve the symptoms of severe depression. They are taken at least 4 to 6 months of the therapy may be needed as the condition may be taken, be used alone or in combination with other medications. So combination therapy may also be given to such patients. Now moving towards the types of antidepressants. Majorly tricyclic antidepressants abbreviated as TCAs, monoamine oxidase inhibitors, selective serotonin reuptake inhibitors, SSRIs, and atypical antidepressants are used and recommended by your doctor. Now in this video we will only be studying about tricyclic antidepressants. Tricyclic means the structural composition of these antidepressants is based on three rings. Tricyclic means rings. These have been used in the treatment since the late 1950s. Still, they are being used. Largest group of drugs agents they are still in use for treatment of depression, referred as tricyclic compounds, meaning three rings. Mechanism of action. So the tricyclic antidepressants mainly inhibit the reuptake of neurotransmitters. They inhibit serotonin, norepinephrine, or dopamine reuptake at presynaptic nerve terminals, thus lead to increased concentration of these transmitters in the synaptic cleft. Takes up to 4 weeks for all tricyclic antidepressants to have an effect. Imipramine. Imipramine is closely related to antipsychotic drug phenothiazine. It is a prototypical example of tricyclic antidepressant. It is used to treat wide class of depression. It is prototype drug. What is meant by prototype? Prototype means we take a single class representative which can be beneficial to represent the whole class of drugs. So we just take example of any one drug which has common properties with respect to other drugs of the same class. It is also used to treat nocturnal enuresis. Usual dose is 50 to 150 milligram daily. We can see here it is composed of three ring structure. Therapeutic uses. The clinical uses of tricyclic antidepressants is mainly in severe depression, phobic and panic anxiety disorders, neuropathic pain, nerve pain, obsessive compulsive disorder, nocturnal enuresis. Imipramine has been used to control bedwetting in children who are older than 6 years by causing contraction of the internal sphincters of the bladder. So by this mechanism, the bedwetting abnormality of younger children of age 6 and above can be inhibited. Adverse effects caused by imipramine are tricyclic antidepressants, dryness of mouth, constipation, blurred vision, mydriasis means opening of pupil size, metallic taste, urinary retention, drowsiness, sedation, weight gain. Now, coming towards the mechanism of this tricyclic antidepressant is that it blocks the reuptake of neurotransmitter so that a neurotransmitter such as serotonin, dopamine, or epinephrine may remain in the synaptic terminal and may be utilized for increasing the happy mood of the patient and may not be just reuptake by the neuronal terminal and get destroyed. So this is all for the first class of antidepressant, which is tricyclic antidepressant. Later on in next video we will be demonstrating about monoamine oxidase. Thanks for listening. You can also ask question in the comment section below. Thank you. Allah Hafiz.